My name's Emily Johns. I'm a marketing manager and I'm the oldest of 4 girls. And our dad was diagnosed with neuroendocrine cancer when he was 44 and he passed away when he was 54.
I'm Malcolm Liggett. I'm a doctor, a cardiologist, heart specialist. So I was 49 years old when I was diagnosed with neuroendocrine cancer.
I'm Rachel and I'm now 44 and I have a daughter who's just about to turn 4. I was diagnosed with NETs at 43.
There's never a good time to hear it. It doesn't matter how they deliver the news. I remember the doctor saying, "You have the same disease that killed your father." I was 25 years old and I didn't know what to expect. After being diagnosed, I quickly learnt New Zealand doesn't have enough resources for this cancer. There is no clear information, no network of support, and very few treatment options in New Zealand.
Neuroendocrine cancer has a lot of different names, and in the hospital we tend to use the phrase NETs because that stands for neuroendocrine tumours, and that's the name given to this whole family of cancers that can occur in lots of different parts of the body.
The diagnosis was a complete surprise, but looking back, I'm sure that I had the symptoms for several years.
He sat me down. He said, "You have a really rare cancer and it's already widespread." He gave me a prognosis of 6 to 9 months. And I asked him whether there was any chance that I'd see my daughter start school, and he said, "No, I don't think so."
Neuroendocrine cancers are really hard to diagnose because the symptoms are often non-specific and don't make the doctor or the patient think that this could be a cancer.
He was in and out of hospital with really bad stomach pains, and he was a tough nut, and they just couldn't pinpoint it, and they diagnosed it with so many different things, and it wasn't until at that 3-year mark that they realised what it actually was.
Surgery is an option, but only if the tumours haven't spread. If it's too late for surgery, the main option is to go to Melbourne and pay for the treatment yourself, if you can raise the $50,000 required. We started Unicorn Foundation New Zealand to help patients get the care they should be entitled to. Neuroendocrine cancer, or NETs, is considered an uncommon type of cancer. However, with each new day, another Kiwi is diagnosed with it. It's time New Zealand offers them the care they need.
So I've been to Melbourne 6 times this year now. I think it's been reasonably tough just in terms of the amount of time that I've had to be away from home and away from my little girl and organising care for her while I've been away.
The option to go for the scan sort of came up when it was almost too late.
If you're diagnosed with a NET in New Zealand, the quality of the diagnosis is good. The expertise is there to treat the patients, but we don't have access to the full raft of treatments that we need to get the best results.
Very passionate about the work that the Unicorn Foundation's doing, trying to raise the awareness of this disease, but also improve access to the appropriate diagnostic tests and treatment for New Zealanders, because I think it's been a long time coming and it's something that really needs to happen.
I think it's really invaluable to have an organisation where I've been able to go to an informal evening and meet some other patients and talk to them about their experiences, and through Unicorn I have become in regular contact with a couple of patients in there. Keeping up with them with emails and texts and things like that has been really helpful.
We're fundraising to bring the right treatment to New Zealand, to provide options for care and reduce the financial burden, to offer hope and give patients time, more precious time.
There's a lot of people out there with a neuroendocrine cancer, and the rates of that are higher than for the more commonly recognised cancers.
Having the scan, it would just be amazing for all families going through this. It's providing a service that could potentially help someone live their life longer. It would just, for a family, that is massive.
The funds we've raised so far mean that patients can now receive the NET scan here in New Zealand. Our dream is to ensure treatment options become widely available. You can help make this happen. Please donate at unicornfoundation.org.nz.